No procedure is without risks. Be sure you discuss the risks that apply in your case with your provider.
The risks from the spinal cord stimulator itself are no different than any other implanted device. One, we tell our patients bleeding, and two, we tell them infection. And those are real concerns. Bleeding being less so, we always check and make sure that they're not on any anticoagulants, medications that would preclude them from clotting appropriately.
There are risks associated with the implant of a spinal cord stimulator, including bleeding, infection, nerve damage. There's a risk of a headache from what we call a post-dural puncture headache if the needle was to go into the spinal sac. You need to realize those risks, and of course we'll do everything to minimize them.
Down the line, meaning once the surgical site has healed, the major concern would be a shift in the stimulation patterns.
If you have a spinal cord stimulator and you're not getting the coverage in the area, what I mean by coverage is that tingling sensation from the device in the area where you're having your pain, make sure you talk to your healthcare professional.
The leads itself can actually move. Now, will that cause a danger to the patient? It won't cause a danger per se to the patient, but unfortunately, if the leads move, the leads may not cover the painful area that they were covering before movement in the spinal column, and that leads to another intervention to try and replace or revise the leads, if you will.
There's other risks, too, that you need to worry about with a spinal cord stimulator. One is that hardware can fail with any implantable device, and it's important that we do things to limit hardware failure, and if you are to have some problem with the hardware, that we help you correct it.